Hi everyone. Welcome back for the financial marathon. Today I'm joined by someone who is really perfectly connected in the medical research, healthcare, innovation, AI, and also venture capital, all in one. Angela is a medical doctor, a two-time founder, an investor, and an IE trainer, and she just do a lot of things, a lot of interesting things. So welcome, Angela. I'm really happy for welcoming you here.
Thank you so much for having me, Jean Paul. This is truly an honor. Thank you.
Ah, thank you so much, Angela. So I had a chance, to talk with you a few days ago in order to really plan this podcast to try to know more about you, more how your background. And what I can say is I was really impressed because you were the only one person that I've met who just meet the medical industry with the AI and can talk about how this will improve your industry and I think that's really impressive. It's really impressive. So I will just let you introduce yourself to the people who may already know you or may not know you. So they will have a chance to discover you today.
Great. First, I would like to say that your podcast is very impressive as well. You also have an amazing background, and I really, really admire your passion for doing this and your entrepreneurship spirit. So,
Thanks so
yes,
much.
about myself. Yeah, of course. About myself, yeah, so as you were saying, I am a physician. My background is in primary care. So I usually attend diseases such as cardiovascular disease, diabetes, high blood pressure, among others. Um, After my medical training, I also, um, as you mentioned, did some public health work with the American Public Health Association. I also was part of the Arkansas Department of Health for a while. And then I had two companies. The first one was related to the CDC. And the second one was a company that aimed to predict emergency room wait times using machine learning methods. Um, and then after that, I joined the NIH, the National Institutes of Health, as a clinical study oversight committee member for them. And after that, I went to the investor side, and now I invest in companies in the intersection between healthcare and technology, and also biotech as well.
Well, that's really impressive. And what drove you, to start your career in the medical industry?
Well, I was 4 years old when that happened. um, yeah, I have felt during my childhood, I guess a call to help others at the very beginning. However, things have been changing through the years, right? I remember when I joined med school that what I wanted to do was genetics. And then during my career, things just changed, and then I'm here. Yeah, but I wasn't thinking when I joined med school, I have to be honest with you, I have to be transparent. I was not thinking about investing, or I was not thinking about um, having my own startup at all. In fact, you will see if you join med school, there is a lot of pressure to follow a certain path in academia and in hospitals.
Mm.
So when I joined med school, that was not my plan at all.
So there is also a pressure, to just to focus on the academia thing and all of that, and less spirit of entrepreneurship, right?
That's right. Yeah, med school is really focused on, and that is great. We need that, right? We need that to advance technologies, to advance drug discovery, to take care of patients. That is needed, but it's not the only path.
Mm. Mm.
Um, so nowadays, I'm happy to see that more colleagues are joining the entrepreneurship side or the investor side or alternative paths that also I think are important for medicine and for
Mm.
patients and for the general public.
I was quite positively, impressed because I think in the world of investing, we need a lot of professionals that already have some background, some experience, because they can judge better. They can judge outside the patterns, but judge with experience of the field, you know. And sometimes it tends to lack sometimes, in some investment firms, Uh, but I think it's really impressive and important to have some people who have some background stories, background life, and that can really bring a value added, to the startups on which they just invest and put capital in there.
I agree with you 100%. I think multidisciplinarity is really important, especially when founding a company, because that allows you to understand many fields that you may want to permeate when creating a product. So I think it's really important.
And just talk about the kind of studies you were doing. I talk about the clinical studies you were doing in NIH. Was it about some disease or some condition or something specific?
Yeah, so for the NIH, I was a clinical study oversight committee member. So basically, that was making recommendations regarding principal investigators um, about the milestones that they promised to the NIH, if they were achieving those milestones or not, making a little bit of financial recommendations, if the grant should continue or not. And I was not doing this just by myself. I was part of a committee of experts in certain fields. And that was a very interesting experience for me because it allowed me to take advantage of my previous background as a physician, as an entrepreneur, and then put that to service to understand a little more about grants, about principal investigators, and of course, to advance innovation in the healthcare field.
When you talk about principal investigators, so me, I think I'm really a neophyte of the subject. So I just want to understand more what is about.
Yeah, so usually principal investigators refer to people who want to conduct a study or who are conducting a study. Um, And those principal investigators usually make part of a university system or a nonprofit system or uh, probably an organization. And the principal investigator submits usually a grant proposal to the NIH, and the NIH can accept or not that proposal. That is based on the objectives of the study and what is the main goal of the study. So
Mhm.
that is like the definition of principal investigator. Usually we see people who are from academia, who are physicians, sometimes researchers, PhDs as well, sometimes students, and sometimes founders as well.
And what I understand is like a committee who just studies, the proposition of grants, for kind of some studies, some clinical studies on some diseases, on some conditions. And this committee studies which grant will go to who, you know, and for what, and if it's important to start the studies now or not. It's a kind of a committee who just deploy some grants by analyzing what, who by analyzing the paper, they just bring them, if I understand well.
Yeah, so basically the committee reviews the grant, reviews the
Mm,
milestone, uh, also reviews the science behind the grant, and
mm,
make sure that the milestones or the goals of that study are being accomplished. And
mm.
with that, as a committee together, we made a recommendation to the NIH saying you should continue
Yeah,
supporting this principal investigator or you should not. Yeah.
okay, okay. And in this kind of paper, they just submit, to the committee. Do they submit? I guess they submit about any kind of disease. And me, sometimes I'm just thinking like we still have some disease, nowadays that we don't know how to cure. And I had a friend a few months ago who learned that she developed, a kind of cancer that we don't have medication in the world. I don't remember the name. It's really complicated, to remember. And the doctor just told her that they just don't know how to fix it. But as I see, like you just mix science with AI, because we talk about this later. Uh, do you think that AI can one day help, physicians find some cure to some cancer that we can't find today?
Yes, I think machine learning or artificial intelligence or AI should be understand, in my opinion, as the perfect accelerator tool. It's the perfect co-pilot for research and for drug discovery and for innovation in the life sciences sector, and of course in other fields as well. But we're seeing, actually, I was reading a paper this morning from a Harvard colleague, and she was describing how machine learning methods or AI was used to accelerate drug discovery for an important medication to treat cancer, actually. And apparently, the studies are not being concluded. The studies are being developed right now, but so far so good. And that tells a lot about what is coming for the future. So I think yes, it's possible to have machine learning or AI methods to accelerate and to give us that extra kick regarding how to accelerate research and development because it saves cost, it saves money, it saves effort from the principal investigators and from the researchers as well. And overall, if we can avoid if we can avoid unintended consequences of that machine learning methods, we can see great advancement in the life sciences field.
Yeah, so me too. I tend to think that AI can be really great, to science, and can just to make earn time, for studies. And me, I just wanted to know more about the company that you just created with the tool who manage rush in emergency in hospitals. How this idea came up? Because in France we
Oh,
had big
yeah.
trouble or emergency rush too.
Yeah, so the company was called Fast ER, and I it was a couple of years ago. And yeah, so it was a company that aimed to predict emergency room wait times using machine learning methods or AI, basically. Um, I remember when I started going to Google I/O, that was in back in 2018, people were asking me in that conference, "What are you doing here? You're a physician. You have nothing to do here." But I saw the intersection of life sciences and machine learning methods at that moment. And I, as a physician, was facing a difficult situation with a family member who was diagnosed with a chronic disease. And that chronic disease caused that person a lot of pain and a lot of trouble. And sometimes the only way to access medical services for that person was through the emergency room. And sometimes even that was very difficult for that person because of pain, because of mobility problems, because of the disease itself. So sometimes for me, like I was like the point of contact to access the medical room, the emergency room, sorry. So with that, I thought, well, we have a problem here, and I'm exhausted. And not only exhausted, I was really sad to see that person suffering. Um, so I started thinking, well, there is an opportunity here to create a solution for a problem that I know not only affects my family member, but also affects many other people in the US and around the world. And that is access to medical services. Usually, people who are underinsured or uninsured um, access healthcare services to through the emergency room. So that increases the emergency room wait times for everybody. So I thought, well, if maybe if people know how much time they have to wait to access medical services through the emergency room, that will benefit everyone. So I started creating my company, and I say, well, if I can use my knowledge of federal databases and combine that with machine learning methods, then maybe I can predict emergency room wait times. And so I started, and that's how the company started, basically.
So now finally, the product was a software that hospital, integrate inside the management system, if I get it well.
So the product was a platform that
Mm,
people was able to access to know
mm,
the times or the waiting times for a
yeah,
medical for uh, the ER for the emergency room uh,
yeah.
here in the US. That was the final product, and it was
Okay,
also um, accessible for everyone. At the very beginning, they didn't have to pay. There was free
okay.
for everyone. So yeah, that's how it started. Of course,
And this,
I faced many challenges during that time. Yeah.
so finally, the system is still active now in here.
No, no, the company finished during COVID time because then
Yeah, yeah.
it was impossible to predict emergency room wait times because of the COVID
Mm.
situation. Mhm.
Yeah,
Yeah.
because the COVID situation was really dramatic and really hard. Yeah.
Yes, and then emergency room waiting times were almost impossible to predict because
Mhm.
there was no information about how much time a patient had to wait to be seen, and that is understandable. We were in a crisis. So yeah, that happened.
Wow, that's really impressive. Like be able, to work with machine learnings and to predict, something like this that can predict how many time people need to wait, depends of the pathology or what, and it's really impressive. And it's felt like you just had to learn a lot of things in the same time. Finally,
Yes, that was actually why I was really interested in AI and machine learning methods because at some point I had to handle software engineers,
mm,
and I had also to understand what they were doing and the code as well. At
mm,
that moment in time, we didn't have uh, LLMs or large language
yeah,
models.
we didn't have that. Yeah.
So, so they were coding from scratch. And I had to learn Python, which is a programming language. And then I started learning more and more about machine learning methods. And at the very beginning, I thought it was a little scary, but then I thought the connection with life sciences because in medicine, we already had evidence-based medicine, and those methods that are used in evidence-based medicine are the same ones that are used for machine learning methods as well. So that was interesting for me because I saw the connection between the two worlds, and that got an interest for me. Mhm.
Well, that's really impressive because I often get curious about another field. Uh, I'm kind of very curious about to use another technology inside my field, and I know it's kind of hard. When you really want to do it with your heart, it's kind of hard, and you really need to give a lot of engagements, a lot of dedication, on that because it's really not easy. but the idea was really great because in France we suffer from ER problems for decades and decades, and and we haven't had a system like this. And every week we just listen that the people just sadly died just by waiting on a chair, and that is horrible. That is really horrible. And you know, we are lucky we are in good health, but it's not everyone who has this chance, you know. And I think it's so much dramatic to just end life like this, you know, by just waiting because we don't have information, because people are just a burnout and less teams and all of that. And that is something that we're suffering here, you know. And I'm myself kind of afraid, you know, to go to my own hospital. Really.
Yeah, yeah, that creates a lot of anxiety, not only for the patient, but also for family members. And I
Mm,
recall being scared sometimes. Sometimes I was feeling powerless, and I thought I had to do something because I was really stressed, really nervous. I didn't want to see my family member in pain, basically.
mm.
So yeah, that was quite the motivation. Yeah.
And just to understand, after so many years in public health, research, as a physician, and what made you switch today in investing in the, if I can call it, in the venture capital world with your fund, with your own fund?
Yeah. So basically, when I was a founder, I had the opportunity to contact many investors and to raise capital for my startup. So that connected me a little to the investment side. And then with experience at the NIH, where I had to assess principal investigators and the research, I also developed some skills. So when I transitioned to the investor side, I thought it was a good idea to blend both experiences, my experience as a founder and my experience as a part as being part of a committee at the NIH, and take those two to understand how to assess the startups, to understand the ecosystem, and basically, and this is going to sound a little naive for me, but I thought it was a good idea to invest in companies that could match what I would like to achieve for patients and for people in general. And I think it's possible, yet. Maybe it's not perfect. I understand that many people may um, feel different about this, but I think it's possible. Yeah.
So today you are just backing the startups today.
Yes.
You are backing what kind of startup? You know, all of them are between the intersection of technology, medical, AI.
Yeah, they're mainly in the field of, well, they're in that intersection between healthcare and technology, also
Mm,
biotech and medtech as well. And an important part of what I do also is mentoring startups because I believe in the power of uh, volunteering, and I believe in the power of giving, uh, well, going the extra mile as well. So I'm also a mentor for Nucleate, and I'm also a mentor for Stanford Engineering, and I mentor startups in that intersection. So yeah, I love doing that.
so what you do is now invest, but also do some mentoring because sometimes I listen. Last time I had a conversation with an American investor who and asked him a question. I know you provide capital, but do you also can help like for some advice and all of this? And then he just said to me like, he was from Gen Z, I think, but he just said like, why? If a company asks me advice, it means I should not invest there because they need to know what they should do, you know. So
I
I had
see.
a little,
Well,
you know.
I think, at least for me, I see, and I don't know what kind of, I mean, there are a lot of different fields to invest in,
Mm,
but for life sciences, this is just my opinion. Uh, Feel free to think differently. But I think, in my opinion, a good pipeline to achieve good results is to understand the science behind the product. And in my opinion, if you have a pipeline where you can take advantage of the academic setting that is happening here in the Bay Area with Stanford, with Berkeley, with UCSF, and translate that to an investment, then you will have a different approach. And
mm,
the best way to network, or the best way to support this kind of ecosystem, in my opinion, is to be involved directly in the academic field with the founders. That is just my personal take. Other people don't like it, and I understand that. But I enjoy it. I enjoy it a lot. You can ask my mentees. So I think having that pipeline is essential for me, and it's essential for the success of a company. Some people, I understand, when they are investing in a company, they just say, here's the money and here are the milestones that you need to achieve. And that is understandable,
mm,
and that is a respectful way to achieve things. I respect that. But from my personal perspective, I enjoy mentoring people, and I enjoy knowing more about the field. Not only for financial purposes, but also because that keeps me sharp. It's not the same to go to a conference or to talk with the founders and to be in that academic setting, that not being in that kind of setting. Uh, that gives you a different understanding how things should happen in the future. So yeah, I think for me it's important, and it makes sense to do that kind of things.
And today, we already had a short conversation around that, but I wanted to get more deeper today. Today, we've seen, a lot of startups come up with the buzzword AI. Like, sometimes when I just see that, I tend to think like, uh, no business today can be made without AI source inside. Uh, in your field, when you have some startups that come to request fund to you, do you have also a lot of startups that AI, or you still have a good proportion of startup which has a common aim without AI?
Yeah, first I would like to say that machine learning methods or artificial intelligence or AI is not always needed to have a product.
Mm,
Having that in mind, yes, I have a lot of startups that have AI uh, embedded at some point in their workflows. That doesn't mean that everything that has AI is a good investment or a good startup. I have seen many startups just mentioning the word AI because they think that perhaps that investor doesn't know anything about that, or that the investor will invest in just buzzwords and not the science behind a product. And that concept connects to the previous question about knowing what the founder is doing and knowing the science behind the product. So not just because it says AI, I'm going to invest in. Yeah.
yeah, being because I tend to. Last week I had a startup because on the side I do some fundraising too for some startups because I have a background in consulting. So startups come to see me, for example, for consulting because they want to understand if they are doing well in the strategy. And I have an example of a startup that I wanted to talk to you about um, because they were doing a tool that makes it easy for medical industry to do some testing.
Mhm.
Because when you do some testing of a product or for anything, you need a lot of paperwork, a lot of accreditations, and all of that. And they were claiming that they had like 17 years, 20 years, 30 years of experience, and that they knew that nowadays companies like that were keep doing it by hand, by paper, manually, and they just come up with a tool boosted by AI to make it much more efficiently to recognize and all of that, all of that. And in this example, AI will be trained uh, by the users. Like AI will make suggestion, and user will say, okay, this suggestion is good or is not good, and all of that. So it kind of made me think of like, okay, to me, it's internal automation in automation, but boosted with AI. And I had a question about this boost by AI because when we talk about medical product, we sometimes we talk about sensitive informations, and this company they were using some LLM, that they were finding around, and they just wanted to sell it in France, in Europe, all of that. But in France, and I already had some client that had this problem is that some companies don't want to make business if they are not sure of where the data are stored. And in France, many companies we like a product that can be, for example, switch on an internal LLM, so in the client site,
Mhm.
or maybe in a French solution like Mr. LI and all of that. And when I told that, they were surprised, you know. But this is, the kind of question I got, the kind of thing I noticed, to more and more startups, and that was the first time I had medical startups, you know. But to my opinion, the AI was not so much necessary, in in, in this application.
Yeah, I think it's wonderful what you're saying. I have another example. Um, this patient was scheduled to have a knee replacement, you know, and
Mm,
the patient got their MRI, the images of the knee, and went to surgery. And the surgery was going to be held with a robot, and the robot was deploying some machine learning or AI um, features. Now, the patient arrived to the OR, to the operating room, and the anesthesiologist started providing anesthesia, so the patient was not conscious. And then the surgeon took those images, the ones that the patient brought for the surgery, and tried to upload those images to the robot and to the machine learning system. That's what happened. They were
wow,
not compatible at all. The
wow.
traditional MRI, the traditional image that the patient usually brings to the operating room, was not accepted by the new technology. So what happened was that the patient was unconscious because of the anesthesia. And the people in the OR, the surgeon, the anesthesiologist, had to transfer the patient to make a new image of the knee, and then after
Wow.
that, go back to the OR with the new image and try to upload the new image of the knee in this new system powered by AI. So a
Wow.
traditional procedure, a traditional knee replacement lasts about 2 to 3 hours. This was a 5 hour procedure. So lessons learned from this experience was that uh, when AI is really needed, how to integrate AI in the current workflow of a hospital or any other kind of field. And sometimes when I talk to founders, they forget that their technology needs to be deployed, needs to be adaptable, it needs to be flexible to respond the needs of a patient, of a pharma company,
Mm,
of of the user, basically. So with that example, I want to highlight what you're saying. Is AI always needed? And if it's going to be needed, how to deploy correctly.
mm. How to deploy correctly.
Yes.
And what we see like in medical world and surgery, all of that, we see they just implement a lot of robot, and now they just implement some intelligence. But the science world is care. You know how to say in English. The science world is paying attention because we always need a surgeon next. We always need someone who has experience next. In case
Yeah.
of because we never know.
Yeah, I agree
You know,
with you
in case.
100%. I was talking at Berkeley a couple of weeks ago, and I got the
Mm,
question like, probably people will trust more AI in the future, in life sciences. What do you think about this? Do you think AI is more empathetic than a medical doctor? So I asked the audience in return, how many of you would like, how many of you have or how many people know someone who has a chronic disease such as cancer, such as diabetes,
mm,
such as heart disease, and raise their hand if they want a machine delivering the news that that patient or that beloved one has that disease. Nobody raised their hand.
nobody. Mm,
So I agree with you that sure, we need to have machine learning methods or AI as a co-pilot, as a tool to accelerate our daily tasks. But to be replaced by AI, that's a different story. Do we want that
mm,
in the first place? Yeah.
mm. That's a good transition because now I got a lot of questions, and I interviewed a guy who worked on the Silicon Valley as a software engineer, and he got laid off and all of that. And uh, what I understood from that is he was saying something really insightful. But I did some research, and after talking to you a few days ago, it gave me another kind of perspective. Like what's happening now, and people are saying, "Oh, they are replacing jobs," but we are seeing a lot of layoffs and a lot of companies. So I don't mention, but a lot of companies are just laying off all of that. And even here in France, what used to be customer center, like people talking to people, calling, doing some customer services. We had a lot of companies that just deleted them and put back some AI agent to do the work. And sometimes myself, I get some call and I tend to recognize sometimes it's AI. Yeah,
Ah,
and it's kind of impressive. And those are the first people that were kind of moved. But me, I don't say because of AI. AI is a good tool that is already used in medical, but will never replace a surgery. AI will never replace a physician. AI will never replace someone who do some research, on some technology or on some disease on something. And I think the difference is in medicine, and I think in other fields like archaeology, research on the ground to discover past civilization, AI is a great companion, as you said. It's a great co-pilot, and it's used well on those fields. But what I see in technology, some people, tend to push it, to maybe uh, make some less uh, intelligent task by the AI, and which give people sentiment, to be replaced. But it's not the technology itself who is replacing. It's people maybe that making that choice. So what's your take on that?
yes, I think it's important to understand that we will be needed to acquire new skills, right?
Mm.
Let me give you an example of this. I love this. So in the 1700s, physicians used to diagnose high blood sugar by trying the urine of the patients.
Wow.
So trying the piss of the patients. If they tested called sugary, then the diagnosis of diabetes was made.
Wow.
The diagnosis of diabetes was made, and that I'm using that analogy to say that I am not a bad physician if I don't try the urine of a patient nowadays, because I know
Mm,
that I can support my diagnosis with other tools, right? Usually now people go to the lab and do some blood work and that's it. I think it's the same for AI. I think we need to understand that perhaps we will be need acquiring new skills and new abilities in our daily works. And that
mm.
doesn't mean that we're going to be less of something, less physician, less software engineer, less, I don't know, in any other field, right? Um, I guess it will be something like learning a new language just out of necessity, right? I guess your original uh, language is French, but you speak English perfectly. And probably you learned that because you needed to communicate to other people. I think basically we need to think about learning AI skills as a new language or as a new skill that we need to have in order to being productive and in order to keep our jobs, basically.
And this is a great transition because I want to talk about the skills that people want to maintain. I had a conversation with someone at McDonald's, and then he was talking to me because me, McDonald's, I discovered McDonald's in 2009. Before that, I
Okay.
didn't knew McDonald's. I just saw that on TV because I come from Congo, and I always dreamed to test one burger. And in the TV, in the past, the movie like Coming to America and all of that, it was McDonald's, but we see that people were ordering on the desk face to face with the workers that were cooking the burgers for them.
Mhm.
And a little by little, uh, technology was introduced. So now we have some automatic screen, and we can tap our order directly on that. And what you said is really right. Is like I think we are. This is maybe my opinion, and I may be wrong, but I think we are entering a new economy, a new kind of economy. Like the world is really shifting. We have a lot of pressure from everywhere. The business is good, but we just felt like it need to like shift itself. The business need to adapt with this new economy line. Um, and I think, as you said, it's really important, for people to upskill themselves, see on what there can be good, and try to know, okay, that skills maybe on that skills I can be good tomorrow. I can always be good on that. I can maybe upskill myself on learning AI. I can maybe do some kind of studies on that field and those field in order to just upgrade my value on the market. And I just took the example of a McDonald's agent is that more and more we needed less agents in the McDonald's because we had those machines. And the people that we don't hire on McDonald's because we have a quota, they are just doing something else. So me, I think AI is pushing uh, people to just do a retrospective on themselves because I had a difficult time finding my words, but I wanted to say that it's a way to do a retrospective on what I know how to do and what can I improve, what I need to learn to still be competitive, and what kind of thing I can create, to in order to be in line with my talent, you know. And I think this is the part that make most of people scared. And when I said to you that I was really impressed with how you learn Python, how you learn machine learning, because it's really difficult. It's not easy thing. And you could have just, stay on your field, but you just went outside of that to go to tech two skills. And what I've seen on my experience, I never seen a lot of people that are doing that. It's really impressive. And I think tomorrow, AI is just pushing more people to just do the step, take the step, you know.
Yes, I agree with you 100%. I think now I want a burger because of you. I want to eat some burgers. No, I'm just kidding. Yeah, so sometimes, and I have seen this before with other trends and other technologies. At the very beginning, when someone deploys a new technology, people find a lot of resistance from their peers. Uh, I think for me, that was true in so many ways. Nowadays, it's more common to find physicians who code or physicians who have some background in other fields besides just medicine. But at the very beginning, it was challenging to prove that that was useful to achieve better healthcare outcomes for patients. And I think the same is true for many fields as well. So, but nowadays, I think people will just go for it. Otherwise, they probably will start competing with people who already have the skills in machine learning methods or AI. Yeah.
And on LinkedIn, I seen a new trend. It's I don't know if I can call it medical, but I seen a lot of startups that are just are emerging in agents. People they just tend to propose some medication or or some food that makes people keep younger. Like stop aging and all of that. And do you think that then that's the big market of tomorrow? Because it kind of make me think of Black Mirror. The science fiction Netflix show.
Yes, I think the longevity field is trending right now. Um, I think it is possible to have a better health span more than a longer lifespan. I think for me, it will be all about the quality of life that a person can achieve uh, and achieve their best potential in a certain period of time. I don't know if people want to live forever or not. I do not personally. Um, but I think regarding the transition to see healthcare not just as a cure to an emerging disease or to a chronic disease, but more like for preventive kind of thing. I'm more like thinking about healthcare or life sciences as a way to have or to achieve a better health span. I think it's possible. We're seeing many startups focusing on that field, especially for biotech, especially for drug supplements or vitamin supplements or any kind of supplements as well. Also, I have seen how there are certain biomarkers that are being identified. Biomarkers means, I know this is kind of tricky word, but biomarkers mean like substances in your blood that keeps the record or tracks something. No, no, not only that, your heart rate can be a biomarker. Your sugar in blood can be a biomarker as well. So we're seeing all this data coming and coming and coming, and I have seen startups using that kind of data to achieve or to understand or to have new insights about how to manage chronic diseases that were killing us before in a different way. So now we're seeing more continuous glucose monitors to track diabetes. We're seeing devices that can count uh, your steps in a day. And we're seeing technologies that perhaps give the patient, not only physicians, but the patient, a better understanding about their health and about how to manage certain situations or certain chronic diseases. I believe not only in the power of saying the physician, here's a whole new story or a whole new labs or a whole new biomarkers for you to have. I believe in the patient having the power to control or to assess or to take decisions about their health. I am a huge advocate for patient empowerment. And I think that startups that can navigate that intersection between patient empowerment, new technologies, machine learning, and hospital workflows can be successful. And of course, that can
So,
achieve a better health span for patients. Go ahead.
so um, I think in kind of 10 years, 15 years, maybe we will have some big shift in the longevity in the medical industry because we will make some huge progress, and this can also enhance people lifespan, people health, you know. So this is the thing positive I see. If we can, cure some disease and make people live better, because what I didn't knew that in United States we have a problem on opioids because people have a chronic pain, on the body, and they just tend to eat some kind of medicine, but this kind of medicine are eaten too much, so become addictive to them, and this is a public health problem also. And we had the same thing also a little bit in Africa. So I don't know why, but looks like with age, some people tend to have a lot of hurt on the body. Depends on the work they are doing too. And so me, I'm kind of confident and really happy, to see optimism and see science have a great future ahead, you know. And what can you tell about the people, what advice can you give, to someone who want to launch a venture uh, um, in this industry, in the medical industry, and what kind of thing he need to focus on? Do we need to take in consideration what will be maybe the world of tomorrow, or do we need to focus just on the product?
Well, I think, first of all, I think they need to have a background that probably touches many fields to understand how to have a good market fit of their product. And with that understanding, probably need to go or have in mind like what do I want to achieve as a company or as a startup? Do I want to get acquired? Do I want my product to be used by certain pharma companies, or am I seeing this as a merger or acquisition kind of a startup? That is important to have in mind. Second, I think it is important to assess the current workflows where the product needs to be deployed, uh, because that will have a translation in better adoption of the product and a better understanding of the product by the consumer or the user. And third, I think it needs to understand what are the needs of the user or the consumer. Um, Sometimes I see startups saying like, yes, I know everything about this product, I know everything about how it works, but there is no connection about how to, there's no connection about what the users want, or the needs assessment is completely out of focus. So I think that is also important to understand the needs of the consumer and the needs of the patient or the needs of the pharma industry as well.
Mm, I think that's really impressive and great advice. And what I like is you really have this 360 view, of everything around, the economy, the health, the technology that is evolving really quickly, and you know how to really give the good advice, the better advice, you know, taking in account all of those parameters. So that was it for my questions, and I think this talk is really fascinating me, and it was really great. And if I may ask, where can people follow your work, connect with you or your team?
Yeah, so I'm very active on LinkedIn. I'm also active in the website leonprecisioncapital.com. Uh, we have an email there. We have a submit form for any startup that may be interested. So yeah, I think that's the best way, LinkedIn and the website.
Okay, that's really perfect. And just the last question, how many startups like do you have a target per year in how many startups you want to invest in? Because I listen some fund have like a 10 startup, 15 startup a year, but do you have this kind of target or it's another way to assess it?
Yeah, I think probably around 7 per year,
Wow.
uh,
Mm,
give or take.
mm,
We are currently seeing a market that is a little slow in mergers and
mm,
acquisitions, and that is a little reluctant because of uncertainty. But we're
mm,
seeing also that uh, perhaps in the future we're going to have a market that is more focused on certain fields in biotech and medtech, and perhaps investments are going that way, especially in the longevity field that we mentioned before.
And when you talk about uncertainty for the M&A, you talk about the uncertainty about economy because around me, we talk a lot about that. I know a lot of companies that don't know how to navigate this period because we have a kind of uncertainty too, and nobody seems to know really clearly where it comes from. Is it just AI or is it just or geopolitics? Is it war? So we have a lot of questions around that. So when you talk about um, the M&A is reduced a little because there is a uncertainty in your mind. Which kind of uncertainty you think are impacting the M&A right now?
Think about what you mentioned is really true. We're seeing a lot of uncertainty and little, let's say, how to say this, that is a little afraid about the current situation of the markets, and that translates in less investments in certain fields.
Mm,
Uh, to answer that question. And of course, the politics of a country, the geographical position of a country, the healthcare system of a country influences how people invest in the US and everywhere else. So, yeah, I think you're right. And we're seeing a transition from what we have been seeing in the last 5 years. And I think that's why it is important to understand the founders and the product really well, because before, investors usually say like, oh, I'm not agnostic, I'm going to invest in absolutely everything. I didn't see funds specializing in certain fields, but nowadays you see that clear differentiation um, is what is being sought by many funds. How the
mm,
product excels, how the product is better than the competitor, sorry. And that I think has an impact in how people invest. If we are dealing with uncertainty, let's go for the things that we know are going to work and that have a clear path of profitability and a clear path of being cleared by uh, federal agencies such as the FDA.
mm. Yeah, that's really clear. Me, I just tend to be a little bit Of course, I'm always optimistic, and but I kind of worry a little about some side of economy that will move, And the problem is, we had a lot of companies here that didn't bother, to think about a real strategy. They were just replicating what a consulting agency were doing to A, that make to B, to C, to D, and all that. But they didn't really think strategy of this new economy correctly because we have a lot of people, for example, into little off subject, but in the insurance market, for example, in France, we have more and more people that can't afford insurations. They can't afford insulation, so they prefer to drive without insulation and to take the risk, the full risk, because they say, okay, no matter what, I just try because I can't pay the insulation. But we have maybe more and more people that maybe will be in this place, and we have like a more high quality cars that will be much more expensive to cover as insurance. And I just tend to think like not just insulation, but a lot of businesses uh, are still to make a new copy about how to thrive in this uncertainty because I'm really sure that there is a huge and a new market that is coming ahead of us, a new market of opportunity for the ones who will know how to take it because we have new markets in Middle East, we have new market in Africa also that will be, the center of convertees, because we will uh, need, to know how to capt, to catch this kind too. So I think it's important, as you said, to have a wide vision, but a precise vision of how your business will thrive in this new economy. This new economy will change fast, is unpredictable, and this is, the perfect combo of what makes a business sometimes scary.
I think those are
So
wise words.
thank you so
Yeah.
much, Angela. It's a
Thank
great
you.
pleasure to have you here and to have this conversation. I think we could go like this for 2 hours, but
Yeah.
you know,
Yeah, that was amazing. Thank you so much. I had a great time talking to you. It was perfect.